SigTalks, Episode 023, Dr. James Sigafoose's Symptoms Video. Today's episode is brought to you by Sigafoose Weekly, a new self-consulting program from Sigafoose.com. It's a $75 per month program that gives you everything you need to make massive changes in your practice and in your personal life. The program consists of the Sigafoose Systems Manual with over 200 pages of office growth and procedures, a private Facebook room that is only for people who have subscribed to Sigafoose Weekly, so you have a worldwide network of like-minded people who are philosophy-minded chiropractors. And if that's not enough, you are also getting the weekly consultation call by Dr. James M. Sigafoose himself. You get all of this for $75 per month. So let me ask you this question: what's holding you back? Isn't it time you become the chiropractor you always knew you could be?
Hello, and welcome to SigTalks with your host, Dr. Carrie Sigafoose, your home for the chiropractic philosophy, where we discuss the teachings of Dr. James Sigafoose, from his writings to his talks and his many audio presentations.
What if every time your patient started talking about symptoms or lack of symptoms, you could just set them down so they could watch a quick informative video explaining to them what is going on? This would remove them from the waiting room when they are talking about a reaction to the adjustment and allow you to have it explained to them over and over and to reduplicate what is going on exactly the same each time until the patient understands what is happening. The symptoms video is an incredibly useful tool in your office for one of the most common reasons patients leave, that being their symptoms are gone or that their symptoms have not yet gone. Explaining that we do not base their care on symptoms but on correction of the spinal misalignments. This video is incredibly amazing in its use and simplicity. So here's Dr. Sigafoose and his symptoms education video.
This discussion on symptoms is very necessary. Some of you have been here 10 visits. Some of you have been here just a few more than that, 10 to 15 visits. Now there's one or two things happening. Number one, you don't have any symptoms. You're saying to yourself, wow, I feel pretty good. What am I coming in here for? It doesn't make any sense to me. It's not logical that I came in with a variety of symptoms or whatever it may have been and it's gone. Why do I keep coming in? Well, let me explain to you why I keep coming in. The reason for it being is if we were to take an x-ray, which we will if you wish, be able to compare that x-ray with the one we took initially, you'd find essentially the same thing because we haven't corrected that bone that's out of alignment that we called subluxation, if you recall. So we still have squeezing pressures on the brainstem and on the nerves, but you don't have any symptom. The reason you don't have a symptom is twofold. Number one, if you move a bone just about the width of one of your hairs off of the nerve, that's enough to stop the signal. It's enough to stop the symptom. So relatively, you'd be able to say, hey, I don't have the symptom. I am well. I don't need to come in. But that's wrong. Now, if you realize this, that as the tissue cells are being replaced, as they come into a normal relationship, they're not sending adverse information to the brain. So therefore, the brain isn't reacting to do the healing, and you are relatively asymptomatic. And you must understand that's not the reason you came in here. We told you initially we're not here to treat your symptoms or your diseases. We told you we're here to correct that bone that's squeezing on the brainstem, and that still stands. Now conversely, maybe you've come in here 10 or 15 times and you still have symptoms. You're saying to yourself, what in God's name, I've been here 15 times, I still have the symptoms. I don't think that you're helping me. That's wrong too. Because again, if we were to take now and realize this, if in fact we've had a lot of pressure on the brain stem and the spinal cord, two things happen. Number one, because of the position of the bone coming back into the covering on the brain stem and the spinal cord, you can get a callus formation, like calluses that you get on your hand, that could still be causing pressure back there on the nerve, causing you to have symptoms, number one. Number two, you didn't get symptoms until you had enough abnormal cells. So let's say one cell became 1 million cells, then 5 trillion cells, all of them dysfunctional and abnormal. Bang, you got the symptom. It's been about 3 weeks or 4 weeks we've been adjusting you. We haven't had time really for the body to replace those abnormal cells with normal cells, so you could still be getting symptoms. That should make sense to you. So what I want you to realize, you can be without symptoms, still need care. You can be with symptoms and be getting better, because the symptoms don't indicate whether or not the bone is out of alignment or not. If in fact we could go out here and x-ray 100,000 people, out of that 100,000 people we find 80% of those people with a bone out of alignment, and yet they have no symptoms. Or they may have some indications. Occasionally they get stiff, occasionally they get headaches, indigestion, a variety of things that the body's trying to tell them that something is wrong. But normally what we do is pop a pill, take a potion, or rub on a lotion, or do something from the outside in to make us feel better. That's not the answer. The answer is to be able to have the body function the way it's supposed to function, from above, down, inside, out, so that all the tissue cells are vibrating, all the tissue cells are expressing life, all the tissue cells are working the way they're supposed to work. If we don't have 1 or 2 or 3 of these cells, or 1 or 2, 3 organs, or just one organ, take one organ and stop it from working. Take the heart, stop it from working. What happens to the rest of the body? It dies, doesn't it? Take a kidney, stop it from working. It affects the body so adversely that they have to have emergency care and have to have continual emergency care to keep them alive. Let's say that the liver stopped working, you're dead. Let's say that the lungs stop working, you're dead. So all this whole body has to work in harmony. It has to be orchestrated so that all the cells are playing the same tune. If it doesn't, you're out of balance. If you're out of balance, it's only a matter of time that you're going to get sick, and or you're going to wish that you were dead because you're going to feel so lousy. So you have been indicated to, over the years, that if I have symptoms, I'm sick. If I don't have symptoms, I'm well. It's terribly wrong. Let's go to the dentist. Most of you, particularly people that are over 40 years old, have experienced a toothache at one time or another. You could wake up one day and say, oh my goodness, I have a toothache, and look and see where there's a cavity. You say, wow, I have to make an appointment with the dentist. The dentist says, well, I can't see you for 2 weeks. 2 weeks go by, the toothache goes away. Question is, if the toothache goes away, does the cavity go away? Do you still have a cavity? Most certainly you do. And unless you get that cavity fixed, what's going to happen eventually? You're going to probably have an abscess and lose a tooth. Same thing goes with your body. You end up with a symptom. You take drugs or you wait and it passes, and something is definitely wrong in the body, or you would never have gotten the symptom in the first place. Now, we can let it go, let it go, let it go. We can drug it, and eventually something is going to happen where you need some kind of intervention, some kind of bold intervention, whether it's surgery or whether it's chemotherapy or whether it's some drastic event that has to take place to even keep you alive. That's not the way it should be. That's the way people think in this country. I will let it go, I'll take drugs so I feel better. Feeling better means I'm healthy. That isn't health, it's not even close to health. Health comes when you don't need drugs. Health comes when you're feeling good some days, bad the next days, but the next day you're feeling good because you recuperate. Health is having an immune system that's able to resist the flu and resist cold so that you don't have to have these shots and potions and lotions stuck in your body. The body wasn't made for that. The body was made to function normally, to function the way it was designed to function, to maintain itself over a long period of time. Question is this: does your thumb hurt before you hit it with a hammer or after you hit it with a hammer? Naturally it hurts after you hit it. Why? Because you have tissue damage. Now it reports to the brain over the nerve system. The brain interprets that, goes back down and does something to allow this thumb to heal up. If it doesn't do that, if the healing process doesn't come, this thumb will never heal up. It'll get gangrenous. We're going to end up losing it. Because there has to be the message getting from the brain to the thumb, or the brain to the body as a whole. And I can't warn you heavily enough. Don't go by symptoms. Don't go by taking drugs to hide the symptoms. Find out why your body feels the way it does. Find out why your body's sick and get it corrected. And if you're sitting there right now and you have no symptoms, be thankful for that. But you still have the subluxation. You're going to have to give it time. And if you don't believe you have a subluxation, let's re-x-ray. Let's re-examine. Let's find out. And if it's there, then let's continue on. Hey, if it's gone, fine. That's the end of it. On the other hand, if your symptoms are still there and you're still having problems, don't think for one moment that this isn't working, the chiropractic doesn't work, and you go out and say, oh, I went to the chiropractor, but he or she didn't help me. That's not true. You didn't give it time. You didn't give time for the bone to be realigned. You didn't give it time for the body to rebuild itself. You didn't give time for the nerve tissue to heal up. You just didn't give it enough time. There's not a one of you sitting out there that ever planted corn on Monday, went out, picked and ate it on Tuesday. Why? Because you had to give it time. You're going to have to give your body time to come back. You're going to give your body time to heal, and it's not based on symptoms. You must understand that. So as you recognize the fact that as this principle of life flowing from the brain over the nerve tissues into the body is getting there in its totality, you may have symptoms or you may not have symptoms. Or on the other hand, if that flow of life is being stopped, you may have symptoms, you may not have symptoms. And if you don't have symptoms, that's the most serious thing. You see, if you have symptoms telling you something wrong with the body, and you take a drug or you do something to stop the symptom, now you become much more comfortable while your body dies. That's not the good thing. It's not the best thing. Hey, I feel great while I'm going under. That's really not what it's all about. Allow your life the awareness. Allow your body the awareness of life. Allow yourself to express this magnificent thing called life, not based upon symptoms, not based upon anything other than the fact that you know that your body has a spine that's been aligned, has little or no pressure on the brainstem or the spinal cord. And you now have a body that's capable of functioning at its maximum potential. And as long as we keep it that way, as long as we maintain it that way, then this physical body can use the foods that you put in it, use the exercise that you give to it, use the vitamins and the nourishment that you put in it, and it's able to function at a level much, much higher than ever before. So, relax, don't worry about the symptoms, let's get the problem corrected. The doctor will be with you in a moment.
And we're back. You know, many people continue to come into our offices based on how they feel. And to be honest, that is not the right reason to be seeing the chiropractor. We ask that they come in for the right reason, and these reasons are to correct the vertebral subluxation, to get the pressure off the brainstem and the spinal cord, or the nerves that come off the spinal cord, to allow the nerve to heal up, to let the life get from the brain back into the body and let the body rebuild itself with normal cells, to get its strength back, to reorganize itself and function exactly the way it was designed to function, and have the healing potential of their body be returned over time by correcting the subluxation. Now, for some of your patients, their pain went away right away. Question is, why are they still coming into you if they don't have the symptoms or whatever it is they came in for? Logically, they would say, if my symptoms are gone, then I should be gone. That's not correct. If their symptoms are gone, let's rationalize why or how they could be gone. When you moved that critical bone that was out of alignment, called a subluxation, moved it just sufficiently to move it maybe the width of a hair off of the nerve, that was enough to alter the signal from the brain to the body and from the body back to the brain, so that the pain of the symptom was subdued. It went away. They could now say, if it went away, why should I be here? The reason they should be here is because the symptom went away, but the bone is still sufficiently pressing on the brain or on the spinal cord or on the nerve that's causing it not to function, even though they have no symptoms. So the mental impulse or life is not getting from the brain into the body in its totality the way it should. So therefore, the body is still incapable of functioning absolutely. Their potential is not there as it should be, and it's a temporary or artificial situation that they are in without symptoms, because their body does not have the opportunity at this point to completely rebuild itself with normal cells, and it won't until you, the doctor, have time to get the bone off the nerve and keep it off. Now, for some of your patients, it's the opposite. They still have their symptoms. They have been coming in for 10 or 15 visits or more. They still have their pain. They still have whatever symptoms brought them in to see you, and they might be saying to themselves, if my symptoms are still here, my chiropractor is not helping me. Maybe I need to go. Well, where are they going to go? They're going to go to somebody who's going to treat the symptom, and they are going to do something that they have been asked not to do while in your office. The fact of the matter is, they still have pressure on the brain and the spinal cord, and they still have loss of life into the body. Their body still has not had time to replace all the abnormal cells with normal cells. You, the doctor, have been working with your patient now, again, 10 or 15 visits or more, whatever the case may be. The bone is moving off the cord. The life is coming back into their body. It may be flowing in there at its maximum right now, and they still have symptoms. Well, why? Well, number one, because they still have more abnormal cells than they have normal cells. So the abnormal cells are doing what they're supposed to do, sending the message to the brain saying that they are abnormal. Until their body has time to replace those abnormal cells with normal cells, using the intelligence in the body called life as it flows over the nerve, they can still have residual symptoms. They can still have symptoms as a result of a callus formation on the covering of the brainstem or the cord as a result of bone pressing on them over a period of time, whether it's weeks, months, or years. They can still have symptoms because an area of the nerve system is still in a state of degeneration and doesn't have the ability to conduct maximum life back into the body. So the body still isn't functioning at its maximum potential, and the body is, in its infinite wisdom, is telling them that it's in a state of problem. So now, if you can get your patient to reflect on the subluxation and the fact that it's shutting life off from the brain into the body, and that's why their body has been acting the way it's been acting, if you can get your patient to stop thinking in terms of a quick fix, if they are still thinking that something should be done simply to get rid of their symptoms, and if the symptom is gone, then they are healing, if you can get them to start realizing that the reason they are sick is because they lost life, and if they can understand that you are working on getting that life to return to their body from the brain, well, then half the battle will be won at that point. Let me use an analogy my father used to use in his practice. If your patient woke up one morning with a toothache, they would call the dentist, and before they got to the dentist, their toothache could go away. But if they looked in the mirror, their cavity would still be right there, right? Of course it would, because the cavity is there. It caused the symptom. The symptom left, but the cavity was still there. And until they go into the dentist and get that tooth fixed, it will remain there. The same principle exists right here. Until they get the subluxation corrected, maintain that correction long enough with or without symptoms to let the body rebuild itself the way it was designed to function, the way it was planned to be. Until they do that, they have lost the potential for maximum health. So we need your patient to stop reflecting on if they are the symptom. We need them to look at, well, the cause. We need them to look at the subluxation. If they need to review what the subluxation is and what it's doing, please get them to do so. Get them to ask you questions. Get them to take home literature that you have in your office. Maybe get them to return for another doctor's talk, or show them the doctor's talk video again so they can be explained to again what chiropractic is all about and how they got sick and how they will get well. But at any rate, for their sake and for the sake of their loved ones, get them to carry on, to continue, and get the problem corrected. Let the life be returned to their body in its maximum, and let the tissue cells be recreated normally so that they can enjoy maximum health, maximum potential without vertebral subluxations. I hope you understand now the importance of dealing with the patient's concerns about their lack of symptoms or the fact that their symptoms are still there. Using a patient education system like the videos we have been reviewing for the past 4 weeks is incredibly important. It streamlines your practice and gives the proper information to all of your patients in the exact same way, while freeing you, the doctor, up to focus on adjusting and caring for your patients without having to repeat the same thing over and over every day. Plain and simple, it frees you up to do what you do while still addressing all your patients' questions and concerns. As always, these videos are available at Sigafoose.com for immediate digital download. You can get them as a group or individually, whichever works best for you and your practice. Even if you choose not to get and use these videos, I hope you are starting to understand the importance of educating all your patients in the exact same way every time. It's my opinion that if you educate your patients and you use the information in these videos in their proper order, there is no way that your patients will not understand what chiropractic is and why it is the utmost important that they continue their chiropractic care with you. Now, next week, we will be reviewing the most important video of all, the maintenance video. And until then, I hope you have the best week ever. This is Dr. Carrie Paboy Sigafoose signing off. Bye.
Thank you for joining us today. If you're interested in more of Dr. Sigafoose's material, head on over for your daily dose of chiropractic philosophy to www.sigafoose.com and register for our free newsletter and to find today's audio clip of Dr. Sigafoose in its entirety. Remember to give, love, do, and serve.